Hi, I'm Amber Lofton, and I'm going to do my informative speech. And here's my license. Okay. And here is my 5 people. We have Logan, Brian, Cassidy, Sherry, and Sheila. Okay. What do Olivia Newton-John, Juliana Rancic, and Christina Applegate all have in common? The most common answer to this question would be they are celebrities. But the answer I'm looking for is they are all breast cancer survivors. There is a large amount of men and women who are diagnosed with breast cancer every day, but they usually don't know how it forms and ways it can be treated. Breast cancer is a very serious disease that shouldn't be taken lightly. Even if you do not have cancer, chances are that you know or will know someone who will get it. Today, I'm going to talk about the breast cancer symptoms and diagnosis, the treatment and side effects, as well as the statistics and ways to lower the risk in honor of Breast Cancer Awareness Month. Breast cancer is diagnosed based on the symptoms exhibited. BreastCancer.org states, breast cancer symptoms vary widely from lumps to swelling and even skin changes. Breast cancer has no obvious symptoms at all until tumors are formed. Just as no two people are exactly alike, no two breast cancers are exactly the same either. WebMD.com explains, when a tumor develops, signs of early stages of breast cancer include lumps in the breast or underarm, swelling in the armpit, pain and tenderness in the breast, a noticeable flattening or indentation on the breast, any change in size, contour, texture, or temperature of the breast, and a marble-like area under the skin. There are many diagnostic tests used to determine breast cancer. One of the tests used is a mammogram, which is a machine that makes an x-ray of the breast and shows any tumors or lumps on the breast. Women's Health.gov recommends that women over the age of 40 with a high risk of getting breast cancer should get mammograms annually, while women with a lower risk should start at the age of 50 and get one every 2 years. Self-exams is when someone performs the exam on themselves once a month. To begin the exam, look at your breast in the mirror with your shoulders straight and your arms on your hips. The next step is to raise your arms above your head. During these steps, you are looking to see if your breasts are their usual size, shape, and color. Next, you feel your breasts while lying down, then while standing up. Use a firm, smooth touch with the first few finger pads, keeping fingers flat and together. Do this in a circular motion, covering the entire breast from your collarbone to the top of your abdomen and from your armpit to your cleavage. If there is an area of concern from the self-exam and mammogram, the next step should be a biopsy. A biopsy is a small operation done to remove tissue from the area to send for further testing. Now that I've talked about the symptoms and diagnosis of breast cancer, I will now talk about the treatment and side effects. Once someone has received the diagnosis of breast cancer, there are several treatments available for them, but they also need to consider the side effects of each treatment. The treatment plan depends on the kind of cancer and how far along it is spread. One option is surgical removal of the cancerous tissue. Another option is chemotherapy. It works by stopping or slowing the growth of cancer cells. Hormonal therapy works in the same way, but on the hormone-sensitive tumors, by blocking the body's ability to produce hormones or by interfering with hormone action. Radiation uses high-energy rays to destroy cancer cells. These high-energy rays, which are invisible to the human eye, damage a cell's DNA. While each treatment does have benefits, there are also side effects to take into consideration. Some of the effects would be anxiety, constipation, dehydration, dizziness, hair loss, fever, and itching. No two people are the same, so the effects differ from one person to another. Now that we've talked about the different types of treatments and side effects, I will now talk about the statistics and ways to lower your risk. Breast cancer is the second most common cancer in women, so they need to be aware of ways to lower their risk. There are staggering amounts of statistics about breast cancer. BreastCancer.org states that 1 in 8 women will develop breast cancer over the course of her lifetime. In 2014, an estimated 232,670 new cases of invasive breast cancer were expected to be diagnosed in women in the U.S., along with 62,570 new cases of non-invasive breast cancer. About 40,000 women in the U.S. were expected to die in 2014 from breast cancer, though death rates have been decreasing since 1989, with larger decreasing in women under 50. These decreases are thought to be the result of treatment advances, earlier detection through screening, and increased awareness. In 2014, there were more than 2.8 million women with a history of breast cancer in the U.S. One can reduce the risk of breast cancer in several ways: eating a low-fat diet rich in fruits and vegetables. Lifestyle changes have been shown in studies to decrease breast cancer risk when in high-risk women. Lifestyle modifications include limiting alcohol to no more than 1 drink a day, no smoking, controlling your weight, be physically active, breastfeed, and avoid exposure to environmental pollution. In conclusion, breast cancer affects millions of people every year. I've talked about the symptoms and diagnosis, treatments and side effects, and ways to lower your risk, as well as statistics of breast cancer. Thank you for taking the time to listen to me and let me talk to you guys about something that all women and men should be aware of. Thank you. And here's my phone paper.
Way to go.